The views and opinions expressed in this podcast episode are solely those of the individuals participating and do not necessarily reflect the views or opinions of Riverbend Media Group or the Riverbend Awareness Project, its affiliates, or its employees. It is important to note that the discussion presented is for informational purposes only and should not be construed as medical advice. Listeners are encouraged to consult with qualified healthcare professionals for any medical concerns or decisions. The Riverbend Awareness Project is a product of Riverbend Media Group.
Hey, this is Melissa.
And this is Emma.
And we are excited to start our first 2025 Riverbend Awareness Project episode. And we are starting off talking about heart health.
This episode is sponsored by the Idaho Falls Community Hospital. And we are joined today by Dr. Blake Wachter, a cardiologist from the Idaho Heart Institute and president of the Idaho Heart Foundation, and Jacob Gilbert, vice president of the Idaho Heart Foundation.
Thank you guys so much for coming in today. We are excited to talk to you. Do you guys want to give a brief little introduction of yourselves?
I'll go ahead and start first. My name is Blake Wachter. I am a cardiologist, as you said. My specialty is also advanced heart failure and transplant. I've been here in Idaho Falls seeing patients for 11 years. Love Idaho Falls, love the patients, love everything about it. I came from Philadelphia to Utah and then ended up here. I love it. We started the Idaho Heart Foundation here in Idaho Falls, and we're here to serve the community. And like I said, love cardiology.
And I'm Jacob Gilbert, small town Idaho Falls boy, born and raised. I am one of Blake's heart transplant patients. Met her 10 years ago, coming into the heart failure world, and ended up needing a transplant. And she has walked by my side the whole time. Mid-40s, born and raised here, like I said. Nothing real exciting.
That's great.
Love Idaho Falls, love my community, and love giving back to it.
You say not too exciting, but I actually think that's pretty exciting. So.
Yeah, Jake is very exciting.
I feel like we can kind of surmise why you guys are passionate about heart health, but what would you say? Why are you guys passionate about heart health?
We will both give you different answers, but they're both the same answer. So I'll go first. Why heart health is important to me is because it means you're going to feel better long term. If you don't take care of your heart and you don't take care of your health, or if you have other conditions that you need to take care of, you will feel bad as you age. And you guys are young right now. As soon as, you start getting older, you start to feel it. And the patients I see that are in their 80s, 90s, that are doing amazing is because they're taking care of themselves. They're getting active. They're eating right. Nobody's perfect. I'm not going to say everybody's perfect. I'm certainly not. But it's very passionate from that. And then we'll get into later about, what we're passionate about with heart attacks and how the public can get involved with that and helping other people survive and stay healthy.
So I'm going to break that age stigma that she brought up. For me, when I was going through heart failure, there was in the front of my mind, everything was, this isn't happening, this isn't real, this isn't true, this only happens to old people and in the movies, right? And that's obviously not true. I was young, just in my mid-30s when I had my first cardiac episode and got introduced to Dr. Wachter here. Why it's so important to me is just for that reason, because it doesn't know an age. It doesn't discriminate against any age or gender or race or creed or anything. It can happen at any time. Heart issues run on both sides of my family, my mother's side and my father's side. And it just compounded, and I got the best of both of them, I guess you could say.
Oh, no.
So that's the reason why it's so important for me is it doesn't matter the age. That heart health is super important no matter the age. Start it as young as possible.
Jake's right. There's some congenital, which means the word means that you're born with it, heart conditions. Those patients are usually caught, fortunately, early. And there's pediatric cardiologist, which is very important. I am an adult cardiologist, which means my age group starts at 18. And I do have 18-year-olds in my clinic. Not all are congenital, meaning born with it. Some have heart conditions that happen with lifestyle choices or bad genes or other things. So Jake's right. It does happen at all ages.
It's really good to think about because I feel like it is a misconception. You're like, oh, that won't happen to me because I'm too young or I'm this or whatever. But you should always be aware of your body and how to take care of it.
So, Jake, I'm curious, how do you go from patient to vice president of the Idaho Heart Foundation?
There's a couple of different reasons why. I think the biggest one is my passion for heart health and for my community matched Blake's passion for heart health and giving back to our community. You know, nobody knows it better than one patient to another. Nobody knows it better coming from the medical standpoint than a doctor. We both have different answers and different outlooks on how things work best for me. And I can relay that to somebody else going through some of the same lifestyle problems, some of the same, health conditions. And then they can relay that back to Blake and say, hey, we heard this, and she can help them determine whether it's going to work for them or not. But ultimately, like I said in the beginning, I think it's my passion matched Blake's passion.
Sounds like you make a really good team.
Not only that, but Jake's being quite modest here. When he was down getting his transplant down in Salt Lake, he was a leader, founder of what is called the Zipper Club, which means he gathered up the patients that were having post-heart transplants or getting heart transplants. LVADs, which are kind of like a mechanical type of heart that, we use sometimes before transplant. But he got these people together as a support group because as a physician, I am on the other side. Jake is on the inside. And having that peer-to-peer, that understanding, I get it. I know what you're going through. I've been there. That is so important. So Jake's work down there continues. He brought that passion back up here when I got to take care of him again as his doctor. And that's the connection we had. And the Heart Foundation was going. He brought to it the heart-to-heart support group, and it was a natural blend.
That's so cool that you guys could see that you both had the passion for heart health to help people just in different ways. And then you used it to make it stronger and reach people in a new way. Obviously, everyone's knowledge grows and expands, but how has maybe the general knowledge of heart health grown throughout the years, and then your individual knowledge of heart health, how has that evolved also?
I think the internet is wonderful and horrible. I mean, I think we all have those
It's
opinions.
a tool.
Don't Google your symptoms.
I know. But I think the people, podcasts like this are getting out to more people. They're realizing that there's heart attacks that can happen. In the movies, in the TV shows, you're starting to see some of the equipment that we use out there. And so it's starting to become more common knowledge. I think everybody has heard about an AED or an automatic external defibrillator. That's what that stands for. You see it in airports. You might see it in a mall. Like, you guys know what that is. But now you're starting to see on the TV shows what is a Lucas device. A Lucas
I think we talked about that last
Right.
time. Yeah.
So a Lucas device is a piece of equipment that the first responders use to do automatic CPR. And let me explain to you why that's important. So if you have a heart attack, in the parking lot of a hospital, that's probably a good place to have it because they can get you in there pretty quick. But if you have a heart attack, let's say, I don't know, somewhere far where the roads get bad and sometimes close down, let's say Swan Valley. I mean, those roads, get shut down with the weather sometimes. It's going to take a minute for somebody to get to you. And then you might need to wait for the plow or something. And so you got a human being doing CPR on you until they get you stable. And if that takes a while and you need to do other medical care, administering medicines, taking care of the patient in other ways, a Lucas device is an automatic CPR that does save lives, and it allows the first responders to take care of the patient in other ways. And the Lucas device does not get tired. A human being to do accurate CPR You get tired. Now, I'll have some of my younger members argue they can go 40 minutes, and I've seen them, they can. But honestly, I've been in enough codes, you get tired after about 2 minutes. So you can imagine if you're waiting for a transport ambulance to get to you and you've got an hour, it's a long time.
And I agree, like the internet can be helpful and harmful. I think a lot of it is that, in the 50s, 60s, 70s, 80s, they were concerned about that shock value, what it's going to do to the public if we let this information out, of how serious it can be. Now I think that's gone, and the internet is such a wonderful tool to show, here is how it could happen, here is what you need to do, here's what it could look like afterwards, those steps, and people get a better understanding of, okay, wait a minute, I'm familiar with that, I need to change this about my life. So, just that shock value going away so much, and it's more of an education instead of just shock and terror. I think that's been a big thing, is going into the 20th century, the 21st century, is we don't have that shock value of how much damage it's going to be for somebody to see it. And yes, CPR is very tiring. No, I can't go 40 minutes.
We were talking about CPR, actually, because we were talking about doing the demonstration and learning, because Emma's done CPR before, right? Because you're a lifeguard.
Not on a person, but yes, we did do training as a lifeguard.
And I think I had to do training when I worked at an elementary school, an after-school program, which, that makes sense. You're around children. You want to be prepared. But it's been a bit since I trained for CPR, and I'm like, I'm not very, strong. And so I'm like, how long and how, forceful do those compressions have to be? And, how long do you have to maintain it? So it's a real thing, to know how to do it and then to be able to maintain it. So those Lucas devices sound amazing so that they can help make it go longer and you're not tuckering yourself out.
Problem with the Lucas device is they're expensive. $18,000 to $24,000. So as our passion of the Idaho Heart Foundation, what we do is we train public. The public is very important in saving lives, and I do want to talk about that, about CPR and AED use. We support youth training youth, just like patients supporting patients. Youth training youth, we have a very large youth group, and we do youth support. In the fall, we do a big party for them. Well, they do the party, let's say. And they train each other on how to do CPR. And they have competitions. It's fun. It's lots of fun for them, and so do BAR. We train at the state fair CPR to the public. It's very important to get that public awareness out there. But to do CPR when you're certified, and I'm a board certified cardiologist. I'm ACLS trained. I'm full court press when it comes to codes. But I've seen a lot of codes outside of the hospital, or as a cardiologist, I'll hear about what went down outside the hospital. Yes, you are trained. See if they're breathing, see if they have a pulse. And I'm not saying that's not part of training, but if you ever see somebody really go down or you think somebody's having a heart attack, it's scary. Hopefully you would run over to them. You would obviously see if they're awake. If they're talking, that means yes, they're awake. Call 911. If you don't call, nobody's coming.
The most important thing to do.
Yeah, call. And then if they are unresponsive, just start pushing on their chest. Because if they are responsive, they'll wake up and slap you. So trying to find somebody's pulse when your pulse is going 150 beats a minute because you're nervous, you're scared, you're not sure if you get it, just start pushing. Just start pushing on their chest right in the middle and push hard. About 100 beats a minute. So there's a couple different songs you can use. Staying Alive is one of them. Baby Sharks is another. Sing something to yourself. Get a rhythm going. And it's not only important to push deeper, but also release from the chest, because then you're allowing the heart to fill back up with blood. We don't do breaths anymore because just that motion of pushing on a chest and then releasing allows air to come in. If you have somebody else that's with you, then you can start getting a little bit more advanced about doing breaths and CPR. But most important thing is keep their mouth open, jaw thrust, back, head back. But simple, call, push, and when you get an AED, turn it on. That's our mission. Keep it simple, because then we'll actually get good outcomes with when the patient comes to us.
That is fascinating. And I think it's interesting you're talking earlier about media and the portrayal of CPR. And I feel like that's a big one, is it's mostly about giving people breath. But you're right. What's really important is getting the heart pumping. So that's the thing to focus on.
The new protocols with CPR is the hands-only CPR, it's called, because they did a study in Seattle that showed that people were scared to do mouth to mouth. And this is pre-COVID, because they didn't want to get germs or anything. And so they found that just hands-only CPR is just as effective. And again, when you do the training, if you're truly trained out there, the listeners, if you're trained in CPR, you know all the steps. You know this is a course that you take, and you take that study, and I get it, definitely. But if you're terrified and you're walking through a public store or something and you see somebody go down, please don't be afraid. Call, push, get an AED, turn on.
Yell for help. The more people, the better.
Yeah, that's true, because more people there might be someone in there that is more confident in their CPR
absolutely.
certification. But keep pushing, but ask for help, yeah.
That fear is what holds a lot of people back, of what if I don't do it right and they don't make it? Or what if I break their ribs? What if I hurt them? The what ifs is what holds people back. And we stop, people ask us those questions when we're doing CPR event trainings. People ask us those questions, and we just ask, what if you don't try something and they don't make it? In my eyes, that's worse than attempting to do some CPR and attempting to help that individual. I would rather somebody attempt to help me, and yes, my ribs are going to hurt. Yes, my chest is going to hurt. Yes, it does hurt afterwards, but I'm here. I'm alive. Thank that person. And that's the biggest thing, is just we try and dispel some of those fears and some of those what ifs in individuals when they come to a training clinic.
A real story here. Apple Fitness, a member of the club, had a heart attack. Within a minute, the other club members and the trainer was on him, was doing CPR immediately. They got the AED immediately. They called 911 immediately. Before 911 got there, now we're talking, they're not that far. So what, maybe 5-7 minutes at the most. I don't even think it took that long. They had already done several rounds of CPR and 2 shocks before EMS got there. The EMS got there and they put on that Lucas device. That person is going home to their family.
Yeah, I was thinking when you were saying the what if this bad thing happens, or what if this bad thing happens, what if you get to help save someone's life because you decided to act? That's, I don't know. I was just thinking about that. That's a cooler what if than what if I do something, being afraid, but yeah.
I think changing that mindset. Oh, you're good.
Yes, that's exactly what I meant. Thank
changing
you.
that mindset is important, because in a lot of those situations, sometimes I feel, I just really hope somebody else does something. Like, please, somebody do something. And so it's hard not to get frozen like you're talking about. So do you have any advice for if you are in a situation and you're just hoping somebody will do something? I don't know. What are some things you can do to prepare yourself to change your mindset to be the one to respond?
Yeah, be that somebody.
just be the person.
I don't think there's a thought process to really go through to change your mind to be somebody, to be able to get down and have the confidence and just do it. It happens so fast. It's either you're going to or you're not. We like to focus on helping individuals have some of that confidence to be able to, and hopefully they don't have to. Hopefully you don't run into a situation where you have to be that person and you have to administer CPR. But yeah, if that situation comes up, here, I learned this from the Idaho Heart Foundation at the state fair, and then I continued my education and I got fully certified. I know exactly what to do. Help, call 911, start CPR, the same steps that Blake just went through. I mean, it's such an instant reaction that you have to have. There is no thought process.
I train residents, which are doctors that are continuing their training to become full-fledged board-certified doctors. And we train them of how to run codes in a hospital. I took a first-year resident. I don't know, I'm probably dating myself, but if you guys have ever seen the show Scrubs, it's been a while.
I've heard of it.
It's funny. It's really funny because it's what being a resident is like. Like you're like, as Jake said, you're like, it's my turn. Where's the closet? I want to go hide. But I took this intern. So there's a code going on. And I took this terrified intern and I said, "Are you his doctor?" And he looked at me and he wanted to run and he wanted to turn away. And I'm like, "Nope. You're doing it. You're getting in charge." And I threw him right there in front. I held his hand and I said, "Talk louder. You got this." And I would coach him along and he was like, "What do I do next?" I'm like, "Ask the room for suggestions. Like, you got this. You got this." So everybody is scared. Everybody is scared. When you see somebody that you think is in danger, your heart rate goes so high and all of a sudden you go into that, that flight or fight mode. So you have to, if you're going to be that person that's going to go in, make sure you're safe too. Don't go into an unsafe situation. Okay. So first of all, don't be dumb. Make sure you're safe. Make sure the patient is in a safe position, but just do it. Just mindset, go, lock and go. Just do it. Have emotions later.
And just like we talked about, I mean, if there is that fear there, I mean, one of the most important things to do is yell for help. Get more people there because just like you said, yeah, the more people that show up, there might be somebody that is fully certified, knows exactly what to do, and they can jump in and help. And call 911. That's going to help save a life no matter what.
They're very quick. Our first responders are very quick.
Thank you for listening to part 1 of our Heart Health Awareness episode, sponsored by Idaho Falls Community Hospital. Join us next time to learn more about how you can support a heart-healthy community.